Bonsoir, bienvenue à tous donc dans cette grande conférence de l'Université de la E-santé de Castres-Mazamet avec ce soir un invité qui nous fait l'honneur de venir de Londres et on le remercie chaleureusement. Il est à la fois médecin renommé, chirurgien spécialisé dans le cancer colorectal, il est membre du Collège royal des chirurgiens d'Angleterre, il est toujours praticien mais il est également à côté visionnaire, passionné de nouvelles technologies et entrepreneur lui-même, puisqu'il a créé la société Medical Realities qui développe des solutions de formation pour des chirurgiens, notamment avec des technologies de réalité virtuelle. C'est le professeur Shafi Ahmed. Merci infiniment d'être des nôtres ce soir pour nous donner, et on va être passionnés parce que vous avez aussi cette capacité à nous intégrer, à nous amener dans votre monde. Vous allez nous donner votre vision du Web 3.0 et du fameux Metaverse. Je vous laisse la parole pendant 45 minutes et sachez qu'ensuite, vous pourrez lui poser toutes vos questions. On peut l'applaudir.
Thank you. Thank you so much. So thank you for the kind introduction and also thank you for the invitation to come and speak here in the south of France. I've greatly enjoyed the company and the warm hospitality. So thank you so much. So we had that panel discussion a little earlier, just giving a glimpse of what we're describing now around the Metaverse, around innovation, around the future of healthcare. In the next hour or so, we'll have a little journey together, talk about what that might mean and my experiences over the last decade in building the technologies and the kind of the ecosystem around XR and the Metaverse. So the first thing to remember, of course, that the pandemic has allowed us to challenge our minds, to reimagine what could be possible in the future. We've had to really think deeply and hard about the changes taking place around us in healthcare. I've been a surgeon for almost 30 years now, a cancer specialist, and I've seen huge changes take place over the last couple of years, from care from being more face-to-face to virtual, with words like total triage, telehealthcare, telemedicine, all playing a role in the future. But I think the first thing to think about is the way that we have to reimagine ourselves prior to reimagining what healthcare might look like.
Reimagine. Rethink. Rewire. Reactivate. Reboot.
So I've been thinking about myself in the last couple of years, about how do I now challenge myself and the ideas that I've been talking about for the last decade. But also thinking about the models of care, the systems that are broken in healthcare, and how can we challenge some of those, but also find new solutions. We have global problems at the moment, as you know. Healthcare costs are rising exponentially. We are having problems with a global workforce. There are shortages across the world of nurses, of doctors, of healthcare workers. So the idea is to create a smarter workforce, a smarter way of working, and a healthcare system that's fit for 2022. So it's unbreaking those rules that we've had for so long and thinking differently. If we go back to the whole world of XR, we've been on a journey and a trajectory. If you go back a few years, we're creating new ways of creating virtual therapy or virtual worlds. This is Snow World, created by researchers in the University of Washington. What they were doing is saying, can we use virtual medicine or virtual therapy or gaming to improve patients' pain control? What they did, patients who had burns, burns is a very painful condition, and you have regular dressing changes. They created the Snow World so patients could immerse themselves in a VR headset, go through a cold snow world, throwing snowballs at penguins, gamification. What they realized with that was that those patients required less analgesia, less opioids. Suddenly, they're using virtual therapy as a tool, as a treatment, if you like, for patients having pain from burns procedures. If we extrapolate that now, what's happened, we've seen the rise and rise of virtual therapy. When I have patients treated for anxieties, for phobias, we're offering patients with mental health disorders like depression and others, therapy in the virtual world. We're now offering women during pregnancy and labor, rather than having opioids or having epidurals, in fact, having distractive virtual therapy to reduce the likelihood of requiring painkillers. This is not just 1 or 2 patients. Tens of thousands of patients in clinical trials around the world showing the efficacy of virtual therapy, that virtual world we're talking about, the kind of journey into that metaverse. So this is real. What we have to think about is reimbursement, the outcomes, the measurements, the support, and how do we commoditize some of these new ideas in our healthcare systems. So that's kind of the preface, if you think about what virtual therapy has been giving us for a while. So we've gone from what I call the snow world, we'll come to in a minute, to the snow crash. We'll explain that in a minute. Also, over the last decade, we've learned a new language. I've just learned a few words in Britain, right? Rather than French, which is a completely different language as in Welsh. The languages around the world we've been experiencing for many years. Suddenly, we have a new language of technology innovation. We have all these words that didn't exist a decade ago. Blockchain, cryptocurrency, AR, VR, XR, AI and deep machine learning, nanobiotechnology, wearable sensors, 5G, mobile computing, edge computing, quantum computing. It's a new world. Are we ready for this new world that we live in? Because one of the things you have to remember, it's not about one word. It's about how they work together. I've often said that we're living in the most exciting times ever in medicine. As a doctor, this is the most excited I've ever been, despite the challenge we have ahead of us. Because we have the tools and power now to reshape what we haven't done before. How exciting for all of us. When we're going very much on a linear transition to exponential growth and change. We are thinking way ahead of the curve. One of the things I talk about with the audiences is around changing your mindset about what's possible. There's 2 types of thinkers in the world. They're the linear thinkers and the exponential thinkers. I'll give you an example of linear thinking. So if I am a linear thinker, for example, I stand here, I take 30 linear steps. How far would we get? If you walked with me, 30 linear steps, how far would we get? End of the corridor, right? Just here, 30 steps. It's sequential, it's equal, you'll understand it. If I said to you, so what's your name? What's your name? Let's say if you stood with me here, and we took, no, just pretend you're standing here, we took 30 exponential steps, not 30 linear steps. How far would we get, do you think? How far can we get to? Any ideas? Aline, you're more an exponential thinker, right? How far would we get? Around the world for 26 times. Yes, wow, but that's true. That's the way the kind of the world we live in is powered through innovation, exponential technologies. So you, all of you, when you leave this room, if you can change from being a linear thinker to being an exponential thinker, my job is done. I'll be pleased. Whether you know what the metaverse or not, it doesn't matter. So when you walk away, that's the technologies that's powering us, and the thought process, not around incremental change, but exponential change. I often call, let's go back, I often talk about the extension to reality. How are we changing from a physical to a digital world? And if you think about what that means, this is the XR. On the one hand, you've got augmented reality, which is where you wear glasses or goggles and you can see the outside world, very much like a heads-up display in a plane or in a car. You can augment the world around you. Virtual reality is the other end, where you put a headset on and you're immersed. You can't see the outside world. In the middle, there's something called mixed reality. All of that, combined with the avatars and holograms, is XR. Just to give you an understanding what that terminology might come across means, because it's all relevant. We discussed the concept of the metaverse, or indeed the Mediverse. So I've been working in this area for a long while. Let's go back a while. 2014. Who remembers the Google Glass? Who had a Google Glass? One person, right. Do you still have it? Have you still kept it? Yeah. So Google Glass came out in 2012, way ahead of its time. It's 2 decades ahead of its time. It's technology that we weren't ready for. So this was me in 2012. So in 14, I picked up the Google Glass. This is a cancer surgery happening, as you can see in real time. I thought I could transmit a live operation using augmented reality across the world. On that day, people on their smartphones around the world could access my points of view surgical operation around the world. And I taught 14,500 people across the world in 118 countries by a simple smart technology, wearable device, and streaming live. It just showed you the scale of connectivity and actually using a smart technology in the way perhaps it was supposed to be. And then we're seeing new concepts coming out. Apple every year talk about, well, we talk about the Apple glasses coming out. And I think finally in 2024, they will commit to bring out their smart version of smart glasses. It's an AR/VR device. So that would be a game changer for the community. Those people on the iOS system will suddenly be engaging in this whole new world. We've seen a kind of plethora of glasses coming out, whether it's Google Glass, Vuzix, the Nreal platform, for example, and others. And of course, now we've got the social media platforms. Ray-Ban with their smart glasses, and Snapchat with their Snapchat spectacles. Does anybody use a spectacle by any chance here, Snapchat? Yeah, how many of you are actually on Snapchat? See, I'm not surprised, because you're all too old, right? Now, that's not supposed to be nasty or anything like that, and I'll tell you why. Snapchat has 300 million active users around the world per month, they claim. 80% of those users are between the ages of 17 and 25. That's why I say you're too old. It's with data, all right? But that's the age of your students and your trainees. You've got to get outside your mindset and think, how do I connect with those young people who are the digital natives, who want different things out of life? So I used Snapchat spectacles, crazily almost, in 2016 or 17 it was, to do a live surgery. Small clips of operations, live, onto my stories, sharing, connecting to an audience that was global. It was the first time it was used in that way. I share something with you. I was very worried about my medical license, because you're now using social media in a way that's not been used before. I didn't have worried. Within a month, that operation I did was watched by 56 million people around the world. Just showing the power of connectivity, simple technology that you can actually scale education on a global scale. And that's been kind of my work over the last decade. Think, how do I scale, teach, and train on a global level? There's no point teaching one or two people in the audience. How do you teach many people? Then, of course, if you fast forward to where we are now, this is 2022, a few months ago. Suddenly, that wearable tech that I was using in 2014 is now much smarter. Rods and Cones, the platform we use now, built out of the Netherlands, allow you to stream live, etc. And then, of course, you working with global companies. It's the collaboration. So I happen to work with Vodafone as their ambassador for 5G and connected health. Then how do we create an economy with connected partners around digital health? And J&J are the company also supporting this. So this is now. If you see the, so if you can see, where's the screen? It's over there. So if you see the middle screen, you see that little box. It's called a gigacube. One click, you're connected to 5G. Anywhere you go, you just connect yourself and get the best resolution. Don't have to have the Wi-Fi. And then you just literally one click, you create a theatre for yourselves. So basically, you're right. So basically what we'll do now, where's your cord? So let's have that round. So there's your... So that journey, going back from 2014, 8 years later, we now got those connected parts, the 5G suddenly being useful. The collaboration with industry partners also wanting to contribute to healthcare. And that's got to be the key going forward. This was us from doing an operation from Dubai to the Netherlands, creating some kind of learning environment using AR devices. So AR is just one component of the world that we're going to be living in. And actually what we're trying to do is democratize healthcare and education on a global level. What about VR? VR has also been quite topical, and again, very important recently. The NHS in England, through the education platform called, well, the Health Education England has just spent 5 million across the UK buying 300 headsets of HoloLens 2 and 300 of the HTC Vive Pro. They want our healthcare workers in the UK to learn in VR. It's an addition to the face-to-face, the online platforms of learning. And they've embraced that at a government level, which is great. VR is not new. We've had technology that's been around for a long time, But now, it's just more powerful. We have now those devices that are much more easy to use, whether it's Oculus Quest, the new Vive, for example, the Pico and others that are now really not tethered, which means not attached to a computer. They have 6 degrees of freedom. You can move in any direction. They have motion tracking, eye tracking, body tracking. Suddenly, the immersive experience is much better. But also, they're more powerful. Suddenly, technology is enabled us to think about this concept. So then, I decided to do something even more strange. This was me, my VR headset. Back in 2016, I did the world's first virtual reality operation, pushed out across the world, so people could connect to operating theatre in VR. And on that day, when we connected the VR headsets around the world, using these kind of either Google Cardboards or VR devices, I suddenly had a connection around the world with 55,000 people connected in VR, in real time, onto a platform across 140 countries, thinking actually this might be the future. This was 6 years ago, remember, where VR was very much in its infancy. It was old technology compared to what it's now, very cumbersome, difficult to use, but it was a proof of concept that this could be part of our future. I then created a company called Medical Realities, and we've been creating XR content for the last 6 years around how do we collaborate remotely, how do we train remotely, how do we create content that's going to be compelling.
Hi, Celia.
Oh, hi, Professor. Thanks for meeting me like this.
To a preset pressure of 14 millimeters of mercury and proceed to do a diagnostic now.
I hear people talking about me.
Okay. And do you recognize the voices? Who is it that's talking to you?
I don't know. 3. There's 3 of them.
What kind of things do they say?
They keep saying that if Josh had any sense, he'd take Jack away from me for good.
So we're trying to work out what does that learning look like, working with global partners to create learning, both for undergrads and postgrads, for nurses, etc., around the disciplines that might make a difference. If we look at the whole simulation, and we're discussing that at lunchtime with a colleague, around what does that look like? Well, we're looking at now how simulation can be transformed using VR training. This is also VR, who's showing that actually by learning a procedure with immersive tech, you can learn 200% more or better than traditional methods of learning. So we're seeing the efficacy around these virtual learning platforms. There's a couple of reports that have come out recently. If you remember, of course, the Mason report from about 6 years ago showing that the VR training allowed you to learn 80% more or retain 80% more information than an online platform. And now we're seeing PricewaterhouseCoopers, their own version of the data across their disciplines around how much more engaged people are, how they learn much faster, much quicker, less time taken. So there are clearly advantages now that we're seeing in clinical trials coming forward. What about the whole world of mixed reality, that bit in the middle that I described earlier? We have these amazing devices, the HoloLens 2, Magic Leap, that 2, which is just coming out now, of course. And these are quite expensive devices, but still they're very powerful in creating this kind of mixed reality world that we live in. What we're seeing with those is now in surgical training or planning in real time, we can now plan operations, putting images from DICOM onto the patient, for spinal orthopedic surgery to plan surgery better. We will now have 2 or 3 companies had FDA approval for use of this in the actual OR. One was just launched yesterday. So we've seen that might help us during the operation, pre-planning, augmenting our world, surgical navigation tools. And this is a team from Japan, Maki Sugimoto's team from HoloEyes, who try to create real experiences using AR, overlaying information in real time on a body. Imagine in the future, as a cancer surgeon, seeing a cancer within the body and saying, actually, I can remove that, you can 3D capture it, and perhaps avoiding structures that are important to avoid. So suddenly surgical navigation, based solely on intuition and knowledge and experience, can be augmented by these navigation tools. We're living that augmented world that we talk about. Augmented the world further, this is what we did Vodafone in Milan, using 5G connectivity. Smart HoloLens 2 is having smart ambulance, all connected through 5G. So you can then connect people to the host hospital. The golden hour becomes more valuable. You have ultrasound machines using AI. Suddenly, that first few minutes of an emergency becomes more profound because you have access to all the technology you need. So we're having smart ambulances, smart hospitals, which we're creating around those lines. I mentioned that journey from Snow World to Snow Crash. Snow Crash was a novel written by Neil Stephenson in 1992, where he described a society that was very unhappy. It was a utopian society where basically it was just in free fall. The big companies were running the community and society, overcoming governments and the federal governments, a society that was broken financially. People wanted to escape from that reality to go into the metaverse. That was the first time that was coined in 1992. It wasn't coined by Mark Zuckerberg, right? Many of us knew about this a long time ago around what that was. So it's a dystopian reality of the future that we're trying to escape from. So that's the story about Snow Crash. And some of you have seen these films, of course. If you haven't, go and see them, whether it's Ready Player One or indeed The Free Guy. It shows you glimpses of what that future looks like. What does it mean to be a player in this world? What can healthcare look like in that environment? So this is kind of where we are heading towards. So the whole journey now is come to this whole concept of Web 3. We're currently in Web 2.0, which is controlled by the tech companies, data stored centrally. We have no ownership, we have no control. So it's a centralized platform that we're working in. What Web 3 is a decentralized platform that we, the people, have ownership, have data access. We create our own environment and create the web as we design it. We share that. That's Web 3. That's what we're trying to create. That's the future of the internet as we speak. We're stuck in Web 2.0. The metaverse isn't just about VR. People get confused with what the metaverse might be. It's an economy. It's a society that we're creating. What does that mean? First of all, it's a decentralized platform, as I mentioned before, the whole Web 3.0. It's going to be based on this concept of data that's secure on the blockchain. It's on monetization using fiat, but more importantly, cryptocurrency as the tokenization. So you can be able to buy and sell things in that environment. It's powered by AI and deep machine learning. It will be all there as our avatars and holograms. So it's much more than a VR experience I've just explained to you. It's a society, an economy, if you like. So, and it's also semantics. We have more control of the outcomes I mentioned before. It's going to be ubiquitous. Anyone could be able to join a metaverse or metaverses, which will be connected through a central platform. So that's kind of what we describe as a metaverse. What about the healthcare city of the future? We're seeing already the layers being built of the metaverse, whether it's infrastructure, so I explained to you about the connectivity piece, whether it's the human interface, the glasses, the headsets, decentralized platforms, the blockchain of this world, spatial computing, the engines or platform, this Unreal Engine 4 and 5, Unity. Whatever we decide to create the platform with, those are the platforms we'll be using. Designing tools, assessing markets, the marketplace, how do we buy and sell, etc. And then this whole thing about ads, advertisements, around ad agencies, etc., built. And then, again, it's that experience that we create. What does that experience look like for a healthcare system in the metaverse? So these are 7 layers described by John Radoff around what's that. Now, you may think this is really, we're nowhere near there. You'd be surprised. There's so many companies already working in that space to help us build that metaverse. Okay? from a gaming company, from ad agencies, to kind of the interface and the device manufacturers. We are getting there through all those 7 verticals, the 7 layers of the metaverse. So we're building that as we speak. Last year, they spent about 50 billion building some of these things in the metaverse. This year, the first 5 months, 120 billion has been put already into this ecosystem. I'm not sure you saw a review by McKinsey came out last week around value creation in the metaverse. They interviewed 3,500 people, 650 CEO levels. And what they mentioned was that 60 to 70% had a positive experience. 60% experienced immersive or the metaverse and thought this was the future. 70% had bought something in the metaverse. So actually, the leaders of our world are saying this is in the future. It's estimated by McKinsey that this metaverse, this kind of industry, will be worth 5 trillion by 2030. That's more than the GDP, of course, of Japan. Anyway, you have to take it with a pinch of salt. They always say these things and overestimate. But actually, we're looking at that future where it's a big economy and where all the big players are coming in, whether it's Google, whether it's Meta, Facebook, Microsoft, are building a mesh for Teams. So in Teams soon, you'll be an avatar, not just a person. They're creating this whole paradigm around this shift in Microsoft Teams. The other thing I talk about is the connectivity piece. As I've been lucky to work with Vodafone for a while, thinking, how does connectivity help us? I call 5G the kind of the covalent bond, bringing the pieces of Internet of Things together. It's the bit that we're missing, that fast connectivity, with a low kind of latency of 0.1 milliseconds and a high download speed of 1.3 gigabytes per second. Sorry. So what we're seeing now is all of these things being enabled by the power of 5G. We've yet to prove that. It's still largely unknown, but we're seeing what that might mean in the future. So if we go into the whole future of avatars and holograms, I've lived in the virtual world for the last 10 years, and some people say that I should perhaps stay in the virtual world, some of my friends, for example, but I'm often real as well. And this is my avatar, by the way. That green thing is me, as my avatar in 2017. What I decided to do was, I thought, okay, how do I connect with people remotely? Can I connect people in different zones across the world? Can I bring an MDT, like a multi-discipline team meeting in my OR? What if I needed advice in the OR from people around the world? And so we decided to create this whole platform around remote collaboration. Can we have that sound? Sound there for me? Anyone? Okay. There should be sound there. But anyway, if the sound's not there, what I'm doing here, that's me wearing my headset. And what you're seeing is 2 other surgeons from India at the Tata Memorial in Mumbai, and a surgeon from the US, all connected to my space in real time. This was 5 years ago. We could share assets like CT scans, images, DICOM images, 3D objects. We can collaborate together, talk to one another, and actually have that interaction that was missing. So we can create these environments now where we're very much into this virtual learning platforms. This was a concept 5 years ago, thinking I've got to do things differently, I've got to be more remote and connect with people. So this was the kind of first experiment with kind of holograms and avatars. But avatars, of course, are a bit different. They're not real. They're like this blue polygonal image. Can you think that would be adopted in the future? Maybe not. So then we moved on to the whole concept of holograms. This was me using 5G technology as my hologram 5 years ago.
Shafi, have a look at this.
Yeah, let me have a look over your shoulder. Oh yeah, I see what's going on there. I think I can give some advice, Carl. No problems. Thanks for calling me.
So that's my hologram, created, by a HoloLens system. It was a bit grainy. It was certainly my Princess Leia moment, right? It was really calling Obi-Wan Kenobi and calling for help, for example. But they're still very grainy. But now we're looking at a phase where holoportation is becoming new. And this is the new concept of digital humans, which I think Christoph will give a lecture tomorrow on, hopefully, around the philosophy of psychology and will digital humans replace us. Shame I can't come to that. I'd love to have seen what you're saying tomorrow, but do go to Christoph's talk tomorrow. I'm sure it'll be very entertaining. It's around the concept, can we replace ourselves in some ways? Do we overestimate human beings? Can we be different? Can we recreate ourselves? So I spent a few years thinking about how do I recreate myself, okay? This is a process called photogrammetry. And I have my own digital human, which I've created, that talks like me, and has some knowledge behind it. If you base that around AI and deep machine learning, suddenly that could be the trainer of the future, it could be the doctor of the future, it could be the interface of that healthcare system rather than a human being. Because we can scale that. You can't scale me, flesh and bones. We can scale some of these ideas around digital humans. The question is, at what point do you accept these to be our agents of change or indeed our healthcare workers of the future? So during the pandemic, this was a company in the US called Aethio. We decided to push that boundary, creating better, more realistic avatars using some of these processes that allowed eye contact and eye movements and mouth movement and seamless integration into a platform.
Dr. Ahmed, good to see you again.
Hey Harrison, so good to see you. Where are you?
I'm in New York. How about you?
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi Ian.
Hey guys, I'm in downtown Atlanta right now. Thanks for joining me. I forgot my magic leap, but I've got my phone handy, so joining you through here.
Thanks for joining us. Should we have a look at some images to help us in this regard? Let's I'm just going to pull up an image of the virus itself, just to show you what it looks like.
So that was during COVID, when we had to be distant, and we had the platform to create learning examples. This is another platform that, going further forward, moving that needle to become more and more real, to be more realistic, to almost seem more human, if you like. This was me in Dubai. I had 8 other doctors joining me from around the world in 8 different cities, using just a 4G phone. On their smartphone, I was in a headset.
Around the tissues of the appendix.
Okay. So he's explaining the CT shows a 6 centimeter area of inflammation, and you can see the tip of the appendix. So he's now showing me what the image shows. That's fine. Thanks, Guillermo.
So again, showing that we could learn. And during the pandemic, as I mentioned earlier to a colleague of mine, when our students couldn't go to the ward because of the pandemic, I brought the ward to them. This was our lecture theatre at Bart's Medical School, and we have 400 seats, as you can see. I brought 70 at a time, social distanced them so they were safe. I went to the ward, did a ward round, saw my patients, and they were relayed back to the lecture theatre. They could engage with the patients in real time, examine them, see them with me, take a history. Suddenly you're breaking that barrier. If we didn't do this, our students would spend a year just doing non-clinical work. So we had to think differently. We're just ready because we're doing it for a number of years. So just think differently about what that experience is like for your students. It's this kind of concept of moving on to the Metaverse, and our students were the first to have lectures in the Metaverse. But I run lectures now, whole courses at our university in the Metaverse. I refuse to do anything else until they change and adapt to new technologies. We'll be the experiment. I'm happy with that. And so it's about driving that ambition around new ways of learning and new working. As I mentioned earlier, things are getting more realistic. What if we could really replace us in a photoreal image or a 3D animation, or indeed what's called a meta-human?
I could be one of many.
Je pourrais être architecte.
Ou guide.
Quizá un artista. You create the narrative. I am metahuman.
So creating that new world, I've just described that story in the history of where we are. So one of the things I launched earlier this year was something called the Metaversity. I want to think, how do we create a university in the Metaverse? So we launched this about 3 or 4 months ago. And actually what we're trying to do is create a kind of a decentralized platform around education so that we could do something differently around the education space. So when we launched that, we thought, okay, what experiences could we create? This is one of them, creating teaching and learning for well-being. You see what we've created here. Please, is it playing? Oh, it didn't play. Don't worry, I'll go back. Didn't play. So we're creating an experience in the VR world where you can walk around, see things, interact with environments. And this we're launching that for well-being training, well-being kind of thing, to alleviate some of the mental health issues we've seen during the pandemic. We mentioned earlier when I was at the panel that we're launching the world's first healthcare city with Animée, and I have been appointed, as great title, the world's first chief medical metaverse officer. I'm really proud. That's like a new word that we've kind of come across. What it means, who the hell knows? I don't know. I kind of figure it out as we go forward about what my role could be in the metaverse. But I'll let you know as I share my experiences. I'm going to introduce and welcome my dear colleague, Dr. Michael Kowdash.
Hello, Professor Shafi. Thank you so much for joining me here in Animé's Health World. I'm Michael, the CEO and founder of Animé's, and I have created together with my colleagues Animé's Health World, an interactive 3D world where people come together, patients can meet doctors, hospitals and caregivers can get in touch with patients and offer the services and support to patients all around the world.
Michael, this looks gorgeous. Tell me more about this space that you created.
So here you see the entry hall of the virtual university hospital that we've created for one of our partners. And it's the first thing that you see when you enter the hospital. You can take a little bit a look around and can decide where to go and what to do. Okay, let me now show you our world and our vision.
Welcome to Animé's Health World, the world's first medical metaverse, offering unlimited possibilities for doctors, patients, caregivers, and the healthcare industry around the world. Patients can get therapies, consultation, education, and social interaction through the power of virtual reality, anywhere in the world, at any time, on all of their devices. Our virtual hospital chain will incorporate a wide range of services and experiences that seamlessly connect patients to healthcare professionals, as it will be easy as turning on their phone from the comfort of their home to connect to a healthcare professional in another corner of the world.
So creating that experience, but also I mentioned earlier about creating much more life experiences. A lot of these things we've seen before, a bit cartoonish, and not particularly attractive, yeah? But what we're creating now is called the Avalon Metaverse in Unreal Engine 5. What you see is incredible detail of that world built in Unreal Engine 5. And what you see now is realistic images from around the world that we're recreating. This is the world that we're creating now for kind of mental health and well-being. As you can see, the quality is incredible. What we're creating now is really good experiences rather than those cartoonish things you've seen in the past. What we've done just recently is we've built the interface around tokenization. We have our token. Cryptocurrency been out for about 8 months on the market to buy and sell health services. We've just started our land sale this month, and we've had many companies, many big organizations buy land in our metaverse to figure out what they can build in our healthcare city. And so we're trying to build the infrastructure around that and what could it look like for other people. The other thing I think that has value is the whole concept of data. Data is a driver for all of us in healthcare, and we've seen that from this conference. But could NFTs, could the data market be strengthened in the metaverse? I think they can. It's more secure with the blockchain. Patients can finally own their data in a much more secure way and perhaps share that as we speak.
Welcome to Animé's Data Exchange, the world's first medical and scientific NFT marketplace. Animé's Data Exchange, secure and immutable data NFTs monetize and finally mainstream and standardize the multi-trillion-dollar market of medical and scientific data all over the world. Data is the gold of the 21st century. Actually, 30% of all data is health data, and healthcare institutions and companies sit on a treasure of unimaginable value. Up to now, data had to be collected in time-wasting and expensive processes. Entire companies and a large amount of data scientists needed months to collect certain data, while still the quality and reliability were unsafe. Animé's Data Exchange creates a completely new market and opens the world's medical and scientific data with one click to and from hospitals, researchers, pharma, AI companies, space agencies, and the self-driving car industry. Animé's NFTs contain medical, pharmaceutical, research, and socioeconomic data, and can serve as a deed of ownership for space and items in Animé's Health City, the world's first healthcare metaverse. Researchers, pharma, CRO, space agencies, car manufacturers, universities, and governments can buy and sell data directly, while the same parties can fund R&D through Animé's NFTs. data providers and anyone participating in the process earn a fixed percentage of the data sold each time the NFT is used and/or sold. Each NFT is flawlessly traceable while always keeping the data provider's anonymity at any time. Each NFT is encrypted so that only the data buyer can access the information while guaranteeing the data's authenticity. The Imidas token makes it easier and cheaper to buy and sell data NFTs while offering advantages to institutional AMIX token holders. Trade, rent, and buy items in space in Imidas Health City through Imidas NFTs. Flawless integration into Imidas Health City, the world's first medical metaverse. Participate in big pharmaceutical trials via NFT ownership.
So it's creating that ecosystem of social economy, as I mentioned earlier. All of those combined form that metaverse. But at the same time, one has to be very sensible. One has to understand standards, the regulatory framework, and to ensure that patients are safe throughout this process. So the XRSA agency is a kind of an organization from the US and the UK, creating frameworks and standards around what that could look like for the future in healthcare. So I think we have to be very sensitive and sensible as we go forward to create this new kind of paradigm shift to what healthcare might look like in the future. So I've spent the last 45 minutes talking to you about the journey, the future, where we might be heading towards. I'll leave you with a quote by W.B. Yeats, of course, that describes that the visible world is no longer a reality for many of us, and the unseen world is no longer a dream. So thank you very much, and I hope you learned something from that 45 minutes. Thank you.
Est-ce que mon micro, voilà. Merci beaucoup. Passionnant, 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 cette plongée dans ce Web 3.0, dans ce monde à la fois virtuel et réel. Écoutez, je vous propose de se prendre une dizaine de minutes avant de partir pour la cérémonie des prix, justement pour profiter de la présence du professeur, lui poser toutes vos questions. Alors, il y a un premier bras qui se lève là-bas. On va pouvoir vous apporter un micro, monsieur, si jamais quelqu'un prend un micro. Sinon, je vais l'apporter. C'est bon, Yann, merci. Et je demanderai, comme à chaque fois, de poser des questions courtes, qu'on puisse avoir aussi des réponses courtes et qu'il y ait un maximum de personnes qui puissent s'exprimer. On vous écoute, monsieur.
Thank you very much for a nice talk. Revolutions have a rise, a peak, and they fail, like empires. 50 years ago, all brain disorders were to be cured by genetics. We know it's a complete fake. Why? Because the disorder is interaction between a patient and a doctor. Your system is fantastic to share knowledge, not for discoveries, and not necessary for treating patients. This depends on interactions, because a disease is a consequence of many factors. You can show me millions of brain images of autistic or Parkinsonian patient. It won't allow me to discover a new treatment. It's a fake idea. And the second comment I had, so it's very good for sharing knowledge, undoubtedly, but that's it. And the second point I would like to raise is more financial. There is no way your Web3 stuff will not be dominated by those who have the money. So you don't solve this issue because this is politics, and politics doesn't depend on what you're describing.
Okay, so 2 points there. The first one is about a decentralized state. I think that's better than what we have already, so it's moving in the right direction. I don't claim to solve all the problems. I'm sure politics will play a big role in this. This is a better way of having better ownership across the world. I'm sure that's the case. Whether it's data ownership by the patient themselves, that's a huge change for a lot of us. When that data has been only owned by specific healthcare systems. And back to your point about therapies and treatment, how do we know these therapies aren't of value? We've seen VR therapy already been shown in clinical trials. These are real results from real patients showing that virtual therapy is indeed of value. Do we know how we treat a lot of these conditions? Can we add value in VR? No one's saying we're replacing the physical world, but it's good for a lot of things, absolutely. Can we add value? Actually have other kind of therapies for well-being, for mental health? We don't have those answers at the moment. It's not about drugs. It's about different way of thinking and experiences that might improve patients' mood and outcome. So we're still discovering that as we speak. And we've got to get away from conventional medicine being all that it is. I've been in practice for 30 years. I have limitations into what I treat my patients and how I treat them. Also, people want more virtualization. We've seen the last 2 years. 3 years ago, the problem with telemedicine and virtualization was not the patients, it was us as clinicians. We did not engage. It's beneath us. We want to face-to-face. It's who we are. Suddenly, pandemic came along. We had to change. And now we're doing a lot of virtual consults, which we didn't believe in 3 years ago. So we are also a problem about change, adopting new ways of not passing knowledge, also interacting with patients. So I'd say the jury's out. I'd like to see where we develop this. We have to change a broken system that's not cost-effective. At the moment, it doesn't give the quality of care that we want. A huge set of patients that are not looked after properly. So I'd say we need to challenge ourselves as well as challenge the system. But I get your points.
D'autres questions, d'autres remarques, justement, cet univers qui prête en tout cas à débat et à questionnement. Voilà, madame, on vous apporte un micro. Je vous demanderai simplement de vous présenter à chaque fois avant de prendre la parole.
Hi. So when you talk about VR, there's a huge problem of disparity between how women see VR and how men see it. So how do you treat this disparity with training for doctors? Because it can create disparity between female physicians and male physicians.
What do you mean by that, the disparity?
Because the way women see VR and using VR like for trainings, for example, if this becomes common, there will be a problem.
Where does that study come from? Where does that understanding come from?
I can show you a lot of studies that current VR glasses are not good for women because they tend to view the things different, and it creates a lot of nausea and problems with women and how they process the vision.
So that's changing. So the newer headsets are much better. That will get better and better. The nausea that was there even much before, back in 2015, with the old Oculus, everyone had nausea. But then now that's largely disappearing from the newer headsets that come out. The latency, the bit rate, everything's much better, and you get a much sense of experience there. I think, look, in terms of as we go forward, it's about saying, okay, where are those challenges about immersive tech? What are the barriers to adoption? The problem's always been the headset itself. But if you have the same technology on a smartphone or a desktop, for example, which is part of the reason why we're creating some of these ideas, that makes it easier for people. So you can't create a digital divide, I agree with you. You can't discard people who may have issues, but that's part of solving the problem. People wearing glasses who have eye problems, for example, women, as you suggest, is how do you accommodate some of those? If you look at some of the new ideas from Meta, the new glasses, the new headsets, it's trying to adopt some of those changes you describe. The focal length is changing, the way you perceive it is changing. So I think in time, they'll be much, much more ubiquitous and more useful and take away some of the issues they describe. But with any new technology, for example, there's always going to be a divide of people that engage, that use them, that don't use them. For example, telemedicine, there's still people that prefer face-to-face. You have to adopt and adapt that as well, for example, for some patients. So I think it's a hybrid model. I think a lot of things we learn will be for some people, not for everyone, but that's kind of where we are. We'll work out what the market looks like. There's still a lot of barriers to adoption as we speak.
D'autres remarques, d'autres questions, d'autres témoignages, monsieur? Alors, apportez peut-être à l'interprète du coup le micro. Yann, derrière toi. Voilà. On est très inclusif. Pour la première fois dans cette université, on a une traduction simultanée en langue des signes.
Le Metaverse, à mon avis, est tout simplement inaccessible à la communauté sourde, puisque de toute façon, il ne permet pas l'expression en langue des signes. Donc, votre représentation du système 3.0, à l'inverse, je dirais qu'il faudrait développer des lieux, des réseaux de façon inversée pour que les sourds puissent eux-mêmes développer ces lieux et puissent participer à cette communauté. En fait, la stratégie, elle serait plutôt à penser de façon à rassembler les gens plutôt qu'à les diviser. Je me pose la question de l'intelligence émotionnelle. Il n'y a aucune expression du visage dans le métaverse. Il n'y a aucune possibilité d'expression émotionnelle dans le métaverse. Je me pose cette question-là. En quoi ça peut être inclusif de ce côté-là?
Okay. Yes. Ah, okay. Okay. So really good question. Thank you for that, by the way. So I think we'll take the second bit first in terms of expressions. A lot of the new technologies allow you to have facial recognition, to map your movements. So they have motion sensors, eye sensors, lip sensors. So it allows you to reproduce what an emotion might look like physically. So if you're in a headset, it might replicate that. So that's kind of interesting. But again, there's work to do and it's down the line. I think, again, it's about that whole division of how do we make it equitable for deaf people, for blind people, for other people. And I think it's going to be a mixed healthcare system. As I said before, one doesn't replace the other. It just augments some of our work that we do already in a different environment. And those are the kind of things we need to sit down and work out what that might mean for patients with dyslexia, with patients that might be blind, for example, or might be deaf. Those are challenges we'll have to face, like any healthcare system. I expect what will happen, it'll be a hybrid model where some things are good in this kind of metaverse, some things obviously much better face-to-face, and some things around telemedicine. And we'll have more platforms to use to diversify our offer to our patients.
D'autres remarques, d'autres questions sur le Metaverse, Web 3.0, l'autre manière aussi de former des professionnels de santé. Madame, on vous apporte un micro.
Hi there, thank you for your presentation. So as you know, I'm particularly interested in virtual care and telemedicine. So how do you see some of the barriers, or what do we need to create to actually have an actual real virtual encounter, meaning that I can examine somebody, not only speak to them? I know there's haptic suits, but how do you see that actually becoming something that we can use in the future without it being overwhelmingly expensive?
That's a good question. I'd also put the same question back to you around telemedicine. You're doing that on a daily basis, I'm assuming, you have done for the last 2 years. In 9 years, and how did you examine them? Okay, so it's still a challenge, right? So parts of consultation are easy, history taking, perhaps delving into past histories or follow-up, that kind of thing. That's very straightforward. Look, I think we're a little away from examination in terms of real haptic gloves and devices. I don't think we're there. We'll probably never get there, I'll be honest with you. But I think having wearables at home, having technologies that might monitor you, that can be relayed into the kind of virtual world, that's certainly possible. So you can still look at parameters and have kind of wearable technology that might be useful and to monitor your patients. But the examination part, I think, the struggle. You can do dermatology, of course you can. You can do certain things that are easy. But actually physical examination, maybe we don't need to do that. Even now when I triage my patients for clinics, I send some to telephone, some for telemedicine, and some I bring to my clinic when I think I need to examine them. As a colorectal surgeon, you can imagine, I need to examine a lot of them, which I couldn't examine them on a telemedicine platform. So that's the choice I make about triage. What's best for the patients? What's best for me? How do I use that health service in a better way that's smarter, that's more efficient of my time and their time? So I think that's the conversation rather than saying, oh, we can get to examine people. We may not need to, may not be necessary. Yeah, of course.
Hop, on va vous apporter un micro, monsieur. Voilà, ça arrive. On vous écoute.
Thank you. Basically, I want to ask 2 questions. The first one is basically, how are you dealing with GDPR in the Metaverse, which is a super hot theme there? And especially with blockchain, I ask, like, maybe most of the lawyers in Europe, and they say that it's impossible. And the second one is, how would you deal with Europe being one of the oldest, let's say, countries, to say it more or less, like they say that almost 40% of the population by the end of 2030 is going to be more than 60 years. So how are you going to deal with old people?
Yeah, so two good questions. I think the elderly people is interesting, and I think it remains a challenge. But say 3 years ago, when you said to elderly patients don't have internet access, they won't access telemedicine, but as soon as the pandemic came, they managed. They found sons and daughters. They got telemedicine on. They did it. We were the problem. We didn't think they could do this, right? They proved us wrong. So again, I'd say don't underestimate the population at large and how they are willing to embrace technology. That's the first thing. I think the whole concept of GDPR is a very good one. We're trying to work with this XRS agency to ensure we're safe. We're still figuring it out. Once we've worked it out, and there's always going to be barriers around the legal framework around GDPR, that's kind of what we're working on at the moment, to ensure that what we're creating is a safe environment for us and also the patients. And I'll tell you more as we develop those ideas, how we overcome some of the hurdles that we described. But we've got a whole legal team working on this at the moment.
Il nous reste le temps pour une ou deux dernières peut-être interventions, s'il y en a. Encore. Non. Une fois, 2 fois, 3 fois. Bah, écoutez, on peut féliciter le professeur Shafi Ahmed d'être venu depuis Londres.